This is assignment 4B, Healthcare Legislation Presentation. My name is Tabitha Wedham, RN BSN with the University of Hartford, Nursing 621, Advanced Nursing Practice, Professor Karen Duhamel, November 3rd, 2022. House Resolution 993, in recognition of Older Americans Act, addressing hunger, malnutrition, and isolation. For a moment, let's discuss the Older Americans Act of 1965. The mission is to maximize the independence, well-being, and health of older adults, people with disabilities across the lifespan, and their families and caregivers. Their vision is for all people, regardless of age and disability, to live with dignity, make their own choices, and participate fully in society. United States Department of Health and Human Services, 2022. The Older Americans Act of 1965 is far-reaching and has a very wide scope. To give you just a brief overview, the Administration of Aging is a federal agency. States have units of aging and tribal organizations, area agencies, as well as local service providers and direct services. The services are vast and include outreach and information and assistance in how to receive services and benefits, care management, transportation to important places like grocery stores, doctor's offices, other places where older adults may need to go, a nutrition program that has congregate meals so that seniors can eat together and socialize, as well as home delivered meals for those who are unable to get out and get their own food. Home community-based services like home daycare, adult daycare, and family and caregiver support, disease prevention and health promotion, as well as the Ombudsman program that is there to help prevent elder abuse, neglect, and exploitation. President Lyndon B. Johnson signed the Older Americans Act in 1965. At the signing, he stated, "The Older Americans Act clearly affirms our nation's sense of responsibility toward the well-being of all our older citizens. But even more, the results of this act will help us to expand our opportunities for enriching the lives of all our citizens in this country, now and in the years to come." Scope and the cost of the program is great. The Older Americans Act, fiscal year 22. This is a pie chart representing the discretionary appropriations for the program. Let me call your attention to the funding. The total funding for the program is $2.177 billion. As you can see, it goes to a wide range of programs, but what I would like to talk about specifically today is Title IIIC nutrition services that take 44.4% of the total budget. This is near $846 million, according to the United States Department of Health and Human Services in 2022. Let's discuss briefly nutrition barriers for older adults. Why is this program necessary, and why is the program so large and so expensive? Older adults, many of them have physical disabilities, making it difficult to obtain food and drive and get to grocery stores and even to stand and make food. Many of them have chronic diseases and syndromes, lack of hunger, loss of taste, smell, or sight, whether it's part of the aging process or part of their chronic diseases or syndromes. Many of them have impaired oral health, making it difficult to chew or painful to chew and eat. Isolation and depression, which also adds to that lack of hunger related to psychosocial issues, psychological issues. Lack of transportation, as I said before, to grocery stores and to see their healthcare providers, as well as poor home environments and caregiver fatigue, making it sometimes difficult for them to get to to be able to get nutrition. Briefly, this is a timeline of the Older Americans Act nutrition services, specifically just the nutrition program. In 1965, as we said before, President Lyndon B. Johnson signed the Older Americans Act, which created the Administration on Aging. A few years later, the congregate nutrition program was enacted so that seniors could eat together as a group, which also helped with socialization issues that many of them were having. In 1978, the home delivered nutrition program was enacted. Many of us may know this as Meals on Wheels, where volunteers make and bring these meals to older people's homes and talk to them for a little bit and give them some socialization as well. In 1979, disease prevention and health promotion. This included nutrition screening and counseling, which was vital for them to access healthcare providers who could help them make sure that they got the correct nutrition. In 2000, they enacted the National Family Caregiver Support Program, which enabled the caregivers of these seniors to also receive these services. And in 2006, they enacted an evidence-based disease prevention and health promotion services, which has been instrumental in helping our seniors stay healthy for as long as possible. As part of this timeline, I wanted to point out that the population of older adults living in the United States is growing at an alarming rate. For the purposes here, the U.S. Department of Health and Human Services describes an older adult as being anyone over the age of 60. And as you can see, in 1965, when the act was signed, or 1960, older adult population was at 16.6 million. And in 2015, it has grown to 47.8 million. And as many of us know, that number is going to continue to climb. So the 5-year impact of the Older American Act, just their nutrition programs. Over 11 million older Americans benefit from their nutrition programs, according to Colello and Napili, 2022. The programs it has supported in 56 states and territories, 600 area agencies on aging, 260 Title VI Native American programs, and 20,000 community centers across the nation. They have served more than 1 billion meals. More than 3/4 of the recipients indicate that the program improved their health and nutrition. They have provided 130 million rides to doctors' offices, grocery stores, and other essential places, according to the United States Department of Health and Human Services in 2022. So that brings us to H Resolution 993. This bill was introduced to Congress March 18th, 2022 by Suzanne Bonamici of Oregon. The bill states, recognizing the value of the Older Americans Act of 1965 nutrition programs in addressing hunger, malnutrition, and isolation, and improving the health and quality of life for millions of our nation's seniors, according to govtracks.us 2022. Let's discuss why this bill. Why is this bill important? The overview includes nutrition programs. They want to recognize the value of the nutrition programs, improving the quality of life by addressing senior hunger, malnutrition, and isolation. They want to recognize the volunteer workforce, which is the backbone of the program. They want to recognize and solicit more volunteers to support the Older Americans Act programs. They want to increase awareness for the growing unmet need for seniors to raise non-federal funds to support the mission. In the previous slide, we noted that the population of older Americans is growing substantially. And what is happening currently with the program is there are becoming waiting lists because there are just not enough volunteers and not enough funds to fund this program and to be able to provide meals for every single older adult in America who needs it or qualifies. So one of the biggest things that this bill wants is the Congress support. They want them to participate in the 50th anniversary of Older Americans Act events by delivering meals to homebound seniors in their states and work to secure sustained federal funding, keeping pace with the increasing cost and demands. So the benefits, if it's passed, it would have a positive effect on health outcomes, the ability to meet higher demand through increased funding, increasing volunteer prospects, and government officials becoming more aware of challenges for their constituents. There are some cons to passing this bill. The nutrition program already costs $897 million. Now, if we were to increase awareness and we would increase demand. But if we were unable to secure additional funds or private businesses to help fund these nutrition programs, it would cause more waiting lists, and vice versa. If we could increase demand, increase our funding, but we didn't get any more volunteers, there would still be waiting lists because there would be no one to make the meals or deliver them. The rising food cost outpaces the support. Some government leaders may not support the bill, resulting in a negative effect for their states. The importance of public recognition for the Older Americans Act nutrition program is to continue funding. These nutrition programs through the OAA provide more than half of the daily meals for millions of homebound Americans. With the rising cost of the program, recruitment of private businesses will be crucial to meet the need. Recruiting volunteers. This program needs a strong base of volunteers to remain sustainable. Volunteers to purchase, cook, and deliver meals. The increasing demand, rapidly growing older populations in the US, and for the programs, demand for these programs will follow. Cost of the nutrition program's highest financial burden, and our nation's leaders must help secure private businesses to invest in this mission. Now, in my opinion, good nutrition can help reduce the burden of the healthcare system. Good nutrition helps prevent falls. It helps avoid unnecessary hospital transports, reduces hospital admissions, it expedites recovery from illness and surgery, and delays or prevents skilled nursing facility placements, according to the United States Department of Health and Human Services in 2022. In summary, lack of adequate nutrition is an issue of extreme importance to the growing elderly population in the US. Passing HRES 993 will help bring awareness and support to nutrition programs offered through the Older Americans Act, improving the health and quality of life for millions of older Americans. Thank you very much.